Hello, I'm Paul Peterson. What exactly is Medicare? What is Medicaid? And what is Medi-Cal? Understanding the differences among the three and what each provides can make a significant difference in one's life, especially if you are a senior citizen. On today's program, we will provide important information on each benefit and how and when they can be used. Please stay tuned for Aging in LA. We all know that Medicare is the federal government program that provides health care benefits to people who are 65 years of age and older, and to younger people with certain disabilities. Medicaid is a federal and state government-funded program that pays for long-term care, medical bills, and some health care services for extremely low-income individuals, and is considered a form of welfare. Medi-Cal is the name of the Medicaid program in the state of California and is jointly administered by the California State Department of Health Care Services and the Centers for Medicare and Medicaid Services. Now, understanding these benefits and how and when they can be used is not simple, but we hope that today's program will give you important information that will help you understand the differences and how to use the benefits when needed. Our guests today are experts in the field of Medicare, Medicaid, and Medi-Cal. Joining us in the first half of the program is Zoran Basic, who is president of NHS, Nursing Home Solutions. He is considered one of the nation's leading experts on long-term illness care and federal benefits. Zoran, welcome to our show. Thank you so much. This gets really confusing sometimes. Now, let's go through them one by one. Medicare is the oldest program. That's the federal program.
First of all, you should be very comfortable with the idea that it's confusing, because it's confusing to everybody. And Medicare is a benefit that we get as part of our retirement. For the vast majority of our seniors, you turn 65, you get your Social Security, you get Medicare, and Medicare steps in as the health plan.
Gotcha. Then this thing called Medicaid.
Medicaid is a federal program administered by the federal government, and you know, California has to do everything a little differently. So in California we call it Medi-Cal, but it is a catastrophic illness program designed to help families in two different areas. One is a welfare component that you mentioned, and that is the issue of people who can't afford to pay for medical care. And it's also known as medically needy Medi-Cal.
Medically needy Medi-Cal.
There you go. And that's the kind of stuff that will pay for people who don't have health insurance and who need to see a doctor, who need to be hospitalized. They'll step in and deal with that. And there's a means test to that, and those are generally considered lower income individuals.
Okay, do you have to lose everything to be eligible for this Medi-Cal component?
Well, the interesting part is yes and no. It depends on which part of the two you look at.
I'm so glad you're here to explain this.
No, it's really, I think, almost designed to be confusing. Medically needy Medi-Cal for people who have health care issues is really a poverty program, if you will.
Okay.
Long-term care Medi-Cal, which is a very well-kept secret, is really available for any family suffering a catastrophic illness.
Wow.
A catastrophic illness defined would be someone who has a stroke, who has horrible Parkinson's or Alzheimer's, and the family can no longer take care of them. It's a catastrophic illness. They need skilled care. They need ongoing care. And Medicare and Medi-Cal, medically needy Medi-Cal and Medi-Cal, actually work together to help these families.
I see. So you can have family members who have been providing support, but these programs pay for institutional care, or do they give support for in-home care?
Well, let's take Mom.
Okay.
Mom falls down, breaks a hip.
Right.
She also happens to have Parkinson's, so the hip break takes her into an acute setting, a hospital setting.
Right.
She has Medicare. Medicare will pay for that hospital stay. They'll pay for her care. They'll pay for her needs. The interesting thing is the shortest stay, if you ever get sick like this, will be in the hospital. It's called an acute stay, usually 3, 4, 5 days. They take whatever steps they need to, and they move you on to a skilled nursing home environment. Medicare will pay some number of days in that nursing home environment, generally up to 100 days. And a lot of seniors hear this 100-day rule thinking they're really going to get 100 days. Most will see 14 to 20, unless they're what is called a feeding tube or respiratory dependent, they're not going to see that 100 days. So our problem is Medicare will take care of your acute stay, they'll transition you into that nursing home stay,
right,
and then they're going to at some point walk away and say, we're done.
Oh boy.
And it's usually in that 14 to 20 day period. And it's at that point that these families are told, hey, listen, you're now private pay, or the worst case is they say, come get them, they're ready to go home.
Oh boy.
And they're really not ready to go home, it's just that they're concerned about how they're going to pay for that ongoing stay for that senior. And that is where long-term care Medicaid, Medi-Cal, is the answer that most of these seniors need to look to, need to be aware of, don't know it exists.
Wow.
It's an excellent program.
What wonderful program. How do you access it, though? Do you need to call an attorney, or are there advocates? Are there people like you that are accessible that can say, here's the deal?
It's a user-unfriendly program.
Oh.
And so the problem we get is a lot of people, first of all, when they hear the word Medicaid or Medi-Cal, they think poverty.
Yes.
So the vast majority of seniors won't even apply because they assume they won't qualify. So let's take mom that just fell down,
right,
had Parkinson's, she's been hospitalized, Medicare paid for that stay, she went into a nursing home.
Right.
And her husband now is trying to figure out what to do with her. The average couple can get Medi-Cal to pay for that nursing home care and can own a house of any value.
Okay, that's a good thing.
Can have $104,000 sitting in the bank, won't stand in the way.
Okay.
Can get at least $2,400 a month in income and still be eligible. Can have all the IRAs, annuities, 401ks, that won't stand in the way. So the average middle-class family with $1 million in assets is Medi-Cal eligible. The problem is they have constantly heard this thing about you have to be poor, you have to be a pauper, you have to be impoverished. So the vast majority of seniors don't even look to it as a solution.
Wow.
And they're missing out on an opportunity that's $6,000 or $7,000 a month. And what they're doing instead is going out getting indebted, reverse mortgages, other things they don't need to do. So Medi-Cal is an excellent program. It's a long-term care component. It'll pay for nursing home care for seniors that need it. And middle-class families is what it was designed for.
Wow. Now, what if the spouse is caring for this mom who fell and has gone through this process? Can these services be provided in the home? Can you?
It's an excellent question. And the answer is, up till now, it has not been provided in the home. And there's a reason for it. The federal government has been burned so much with abuse that they would much rather pay larger dollars and have doctors and nurses and responsible parties than pay families that are not necessarily accountable. But there are pilot programs out there now where they're actually looking at the family as a caretaker and looking at having the family take care of this particular individual and pay those dollars home, which would be cheaper, better for the family, better for the senior. But up till now, they have not found a way to police, if you will, how these seniors get the care and to make sure they get the care. And where the abuse seems to have been in the past is board and care and places where seniors have been left too long.
Right, just warehoused.
Care of them.
Exactly. We've had to struggle with these issues in the family, not because of cases of need, but who provides the best care. Absolutely. And it rarely is a big institution.
That's correct.
What we discovered is that a mom-and-pop sort of operation in a residential facility is providing wonderful care for our Aunt Ruthie, who has Alzheimer's. And they're doing a wonderful job. And I know it's cost-effective because the bill's smaller.
Absolutely. And I think in the long run, you're going to see that that's the direction we're going to go in. But right now in California, you're looking at Medi-Cal happily paying for skilled care for your average family, middle-class family.
So how did you get interested in these things? I try always to ask our guests.
30 years ago, I was part of the California, or the U.S. version of the Peace Corps. Worked here, was in Loyola Law School, started a nonprofit called Gray Law, and we were working with seniors in downtown Los Angeles.
That's a long time ago.
It was a long time ago.
Wow.
In fact, it's aging me as we speak.
Both of us.
And the result is we were doing free work for seniors, and when you start doing benefits and you start asking questions and you're trying to feed somebody and you're trying to get housing for somebody, you find out there are programs out there that most people don't ask about.
Yes.
And then you try to make those programs available. The problem is long-term care Medi-Cal is still a pretty well-kept secret. Seniors don't know this. In fact, it's excellent that you're asking these questions because hopefully these seniors will find out. They don't need lawyers. A lot of these seniors will qualify just because they fit within the parameters.
They're in the profile. I got you. Right.
But sometimes you'll get a senior with a house, and they may have a house up in Big Bear that they have had for years.
Right, and they're fearful of losing it.
They're fearful of losing it, and they're thinking, well, gee, I have a house, and I have a house in Big Bear, so I'm not going to qualify, because he said they can have a house and they can have $104,000. Well, there are all kinds of exclusions, exemptions, plans that you can do within the federal government that will accept that piece of property and still get benefits. So the government is not intolerable. It's just that it's not user-friendly and people don't know.
Well, I always hope that people will plan a little bit better than coming to a moment of crisis when decisions have to be made. Is this something that someone in, say, their mid-40s who may be providing care for a parent should be thinking about? It's like, let me see what the eligibility is here and what the next steps are?
I'd like to say yes, but the answer is no. And here's why. A lot of this estate planning stuff, a lot of these lawyers that are doing all these sophisticated plans and trusts and wills and all that, you have to know who's going to get sick. And the problem with that is if you're shifting to the right because you think mom's going to get sick, you can be surprised to find out that dad goes first and everything you shifted in the wrong direction now is locked into play.
Right. Yeah.
So what we suggest is until you have a pretty good indicator, until you know where the problems are going to be, you want to leave things broad. You want powers of attorney for healthcare, powers of attorney for finance.
Right.
You want to have simple wills or trusts in place so that things can move in either direction without necessarily locking yourself in. So as much as I'd like to see a plethora of people coming in and talking to us, it won't do them any good till we really know which direction we're going in.
Okay, well, let's talk about a plethora of people coming in. We have some numbers, contact numbers, so people can access your services, but also the Nursing Home Solutions, the company you're the president of. So I want to get them up on the screen if we could. So those of you at home will know what to do and who to write to. Here's the 800 number. And what is that number again, Zorn?
1-800-7-SENIOR.
Oh, that's too easy. 1-800-7-SENIOR. And there's a website, I assume.
That's right. And it's www.nhscare.com.
Nursing Home Solutions Care. Let me ask this question. How are we doing in terms of administrative costs? A lot of people knock Medicare and Medi-Cal, but it seems to me they got pretty low overhead compared to the private sector.
If you ever sat down and you figured out what a person who works 50 years pays into the system in terms of taxes, for benefits, and if you then put an interest component to that and you ran it for the 50 years, you'd find the vast majority of us never utilize what's already been paid for us, let alone what's available. So this is kind of a shell game, if you will. But most seniors are not taking advantage of the dollars they have available to them. And if I can put a warning out while we're talking.
Please.
A lot of seniors are getting reverse mortgages, which can be a very good tool if they have funds, they need funds, they have a house, it's pregnant with value.
Right.
But they have to be very careful because these reverse mortgages have a clause in them that will say if you end up unable to live in your home because you break a hip, you end up with dementia, and you have to go into a nursing home, that loan will come due if you can't stay home for 12 months or longer. So the end result is a lot of these loans that these seniors are getting to enable them to stay home can actually trigger the loss of the house. And here's the exact scenario. You get a senior who brings his children home to live with them to take care of him or her so they can stay home. And they borrow these dollars out of a reverse mortgage so these dollars will help support them. And then something terrible happens where they are hospitalized and they can't come home for a year. At the end of that year, the house might be gone.
Might be gone entirely.
And now the support mechanism, the kids you needed to be there aren't living there because the house is gone. You have no way to go home. And that's a disaster.
Of course it would be.
Just a warning to them not to look very closely before they take that step.
Well, now, you mentioned you put a dollar amount. You can have like $1 million in assets and still qualify. But is there a cap? Is there some place beyond which you can't go?
Well, if you have a $4 or $5 million estate, you don't need the federal government.
True enough.
You know, you've got enough money. You're generating enough. You're fine. But the average U.S. citizen, the average middle-class American's got a house worth $500,000-600,000. Used to be worth 7 or 8. Down to 5 now. Maybe down to 3. But they have some savings. They've worked hard. You know, everybody is proud of what they've done. And most seniors want to leave something to their kids.
Absolutely. That's part of the whole planning
process. Part of the American dream.
Right.
And so, no, they're middle-class families. They really are middle-class families. Right. There's no abuse of the system.
So it's been a treat to talk to you, and I'm feeling much more hopeful. And thanks to our guest in the first half of our program, Zorn Basic. But it's now time for a short break, and when we return, we will resume our discussion of Medicare, Medicaid, and Medi-Cal. We'll be right back.
The Los Angeles Department of Water and Power wants to give you up to 7 free shade trees just for completing a workshop, either online or in your neighborhood. The Trees for a Green LA program offers LADWP residents over 40 different varieties of free shade trees. Trees benefit the environment, save energy, and add beauty. Get your trees by participating in an online workshop by logging on to ladwp.com/trees or call 1-800-GREEN-LA.
It's fun to be a good neighbor, so say hi to your new neighbors at the LA Zoo. And bring Grandpa. They've got a walking buddy for him, too. They've expanded, so there's even more to see and do. Don't wonder who's here, because just for kicks, they've got birds on sticks. Whatever you do, make sure Mom and Dad come early, because they're certainly ready to say hi to you. And this invitation comes from your good neighbors here at the LA Zoo.
Welcome back to Aging in LA. Our topic today is the Medi mix-up, and we are discussing Medicare, Medicaid, and Medi-Cal, the differences among them and how seniors can use their benefits. Joining us in the second half of the show is Eileen Harper, Executive Director of the Center for Healthcare Rights, a nonprofit healthcare advocacy organization dedicated to assuring consumer access to quality health care. Eileen, thank you so much for joining us today. Now, you brought some important information that our viewers need to know. For example, there are some changes in the legislation for Medicare now, right? And is that going to impact a lot of people?
Well, basically the most recent Medicare legislation did result in some changes in the program. Nothing, on a huge, major scale. Probably the most important is an actual expansion of the Medicare coverage for mental health. Right now,
an expansion of it.
Well, expansion in that right now the way the program works is that there is really significant cost sharing when people use the mental health benefit. Medicare only pays about 62.5% in terms of the bills. So by reducing the cost sharing over a several-year period, what will happen is that Medicare beneficiaries will have much better access to mental health coverage than they had previously.
That's the good news. Of course, so many of these changes are alarming to our senior citizens. The moment they hear change, it's like, oh, I'm dependent on those benefits.
Right.
Is there an outreach program, or in fact, are you doing that to try to reach out into the community and help people understand some of the subtle differences?
Right. Well, what our program does, Center for Healthcare Rights, is we provide Medicare advocacy and health insurance counseling services here in the LA area. We're funded by the City Department of Aging, and we're also funded by the LA County Area Agency on Aging. We have a telephone hotline that people can call us. I believe we're going to show it today.
Right. In fact, we'll put it up now. It's an 800 number, so
and
there's no cost to this.
People can call us Monday through Friday and basically ask us any questions relating to Medicare. We also try to make sure that we provide services in other languages because we have a very multicultural population here in LA County. So we try to work hard to make sure that our services are available in other languages for many Medicare beneficiaries who don't speak English. One of the things that we've been doing in the last couple of months is actually running public service announcements on a variety of television stations to try to encourage people, older adults, or family members to contact us if they have questions or problems relating to their Medicare.
Now, I think one of the most amazing things to me as I walk through the various communities in Los Angeles is how many people who are dealing with senior issues think they're all alone.
Oh, of
and
course.
They're not. I mean, the statistic you provided us with, there are, what, a million persons?
There's a million Medicare beneficiaries in LA County, yes.
That's a staggering number.
Yeah, you've really sort of hit it on the head. I think a lot of families, until it happens to them in terms of dealing with Medicare or dealing with, let's say, a medical situation, or mom's in the hospital, mom has to go to a nursing home, really it's families, that's the first time they're really dealing with Medicare directly. And Medicare, as you know, is not comprehensive. There's lots of gaps in coverage. One of the main gaps is that Medicare does not pay for custodial care in a nursing home. So I think at that point a lot of families sort of are scrambling trying to get information in terms of what are our next steps? How do we plan for the future? How do we deal with today?
Right, and that's in addition to dealing with the emotional impact of having a senior loved one suddenly unable to care for themselves or needing special care. I know I was amazed when I saw within the Department of Aging, both city and county, how many people there are to help you. They are experienced, they are sympathetic, and they possess so much information, programs that you never dreamed existed, and yet here are trained professionals ready to help you. Now, for example, the ombudsman thing, I always thought that was one of the great programs that was instituted for people who have issues with nursing homes, assisted living, that there's actually a person who will be your champion.
Right, in a nursing home setting or in a residential care, Well, I mean, our organization does something similar, but we're focusing on healthcare access. We're focusing on what do you do when you're having a Medicare problem? What do you do if your Medicare HMO isn't providing the services that you believe you should be getting? What happens when the hospital tells you you need to go home and you believe that you really are not well enough to go home? You know, what are your rights? And those are the kinds of things that we can respond to if people contact us.
Yeah, because so often I've had people complain to me that they feel like they're being kicked out of the hospital, like they need the bed.
Well, that's because of the way Medicare pays for hospital services. I mean, I think your previous guest was talking about the typical stay in a hospital right now is about 4 or 5 days, which is true. And I think a lot of older adults and some family members think, well, Mom will stay in the hospital until she needs to go home, and frequently that's not the case. She'll stay as long as she needs an acute care stay, and then basically she'll be discharged either to go home or to go to a nursing home or another type of level of care.
Right, and so often, say there's been a fall, broken hip, as Zorn was mentioning, suddenly you are going through a step-by-step process from the hospital to rehabilitation and then to assisted living, and you never get a chance to get a hold of it. What's happening to you? Who's going to pay for all of this?
Well, I mean, I think a lot of families, unfortunately, are getting those answers. I mean, for example, if they contact us, they're getting those answers, but unfortunately, they're not getting them in a planning period. They're getting them in a crisis situation. So they're sort of dealing with a lot of dynamics. They're dealing with sort of the emotional situation. They're dealing with having to sort of organize everything in a very, very quick manner.
Speaking of planning period, you alerted us to the fact that the next Medicare Part D, which is the prescription drug access, the enrollment period opens up again.
That's right, November 15th.
November 15th, 2008. So what steps do people need to make sure that they'll get this coverage?
Well, I think most people who are already participating in the program essentially have gotten their feet wet over the last 2.5 years in terms of becoming familiar with it. I think in terms of planning for what to do next is that I think everyone who wants to participate in the program, what they should do is go, if they have internet access, is they should go to the Medicare website in November to sort of take a look at the information on the plans for 2009. If they think they want to stay with their current plan, they should make sure that their medications are still in the formulary for next year. And they also should check to see what their cost sharing will be for the coming year as well. I mean, one common question that we frequently get from Medicare beneficiaries is coverage in the coverage gap or donut hole.
That
and
donut
so
hole.
for people who have very high prescription drug costs, who take lots of brand name medications, that would probably be something that they would want to check on. Now, only 20% of the Medicare population gets on the internet. So for those people who don't have internet access, they should probably give us a call starting in early November. And what we can do is we can help them identify maybe 2-3 plans that may be most appropriate for their medical needs, and then they can decide which one to enroll in.
I see. But this is particularly important if you're walking into the pharmacy and suddenly getting a $450 bill.
Well, also the enrollment period is very short. It's November 15th through the end of December, so they don't want to wait until close to the, exactly.
Well, okay, so you heard that now. There is just 6 weeks here, November 15th to the end of the year, where this enrollment period is open again.
Right.
Now, how long does that extend, the enrollment period? Is it for the full calendar year?
Basically, this is the annual election period. So for many Medicare beneficiaries, this is the time when if they want to make a change, they make the change. Now, if someone is in a Medicare Advantage plan, let's say a Medicare HMO or PPO, they have an additional 3 months, January through March.
Wonderful.
Now, people who have Medicare and Medi-Cal, they can change their plan monthly. So the people who really need to focus on this November through December period are people primarily who have Medicare, they're not eligible for Medi-Cal, they're not in a Medicare HMO. This is their opportunity to make the change.
All right, now, you've been warned. Unfortunately, Eileen, our time is up for today's Aging in L.A., but thanks so much to our guests on today's program. Eileen Harper, who gave you great information, Executive Director of the Center for Healthcare Rights, and in the first half of the program, Zoran Basic, President of Nursing Home Services. Now it's time for our feature, Senior Stat Shots. And once again, we found today's statistics in the recently released L.A. County Seniors Count, a survey of the older adult population in Los Angeles City and County. Now, since we talked about federal and state benefits for seniors in our program today, let's take a look at statistics that reflect how seniors are covered by insurance, both public and private. 70% of seniors living in L.A. County have medical insurance. 39% have dental insurance. 53% have prescription drug insurance, and 37% belong to an HMO. 10% of the survey did not respond to this question. And when asked what they are unable to afford in their present circumstances, 9% said they cannot afford medical care, 18% they couldn't afford dental care, 9% cannot afford prescription drugs, 13% couldn't afford vision care, and 11% cannot afford hearing care. 55% of the respondents were able to afford all of these medical needs, and 15% of those surveyed had no response at all. And that's today's Senior Stat Shots. You can get your own copy of this fact-filled survey by simply going online to www.ladcss.org, which is Los Angeles County Community and Senior Services. Click on LA County Seniors Count, and the full report will appear. Or if you like, you can have a copy mailed to you by calling area code 213-738-2065. That's 213-738-2065. The Los Angeles Department of Aging produces this program with CityView, Channel 35, so that seniors living in Los Angeles and surrounding communities are well informed on the many issues that face them in everyday life. And also to let you know of the many services that the Department of Aging offers our senior citizens. Now, we'd like to hear from you with comments on the program, what you like, what you think can be improved, and ideas for future programs. So please give us a call. The number's there on your screen, area 213-252-4088. That's 213-252-4088. Call us with your comments and ideas, and we look forward to hearing from you. I'm Paul Peterson for the Los Angeles Department of Aging, the people here at CityView, Channel 35, and all of our guests on Aging in LA. Thanks so much for watching. We'll see you next time.